Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Welcome back, everyone. Looking forward to getting into today's show, which is going to all be about strengthening your libido, your metabolism to burn more body fat, increasing your stamina, balancing out those hormones or improving low hormone levels naturally, as well as boosting mood with one little hormone precursor called dihydroepiandrosterone. And that is going to be pronounced today DHEA. So we're going to abbreviate it for simplicity's sake as DHEA. So what I want to share with you here today is that, believe it or not, even though this is really well researched obviously it's a natural hormone precursor inside of the body. I'm going to explain why we call it a precursor inside the body as a hormone, but lots of science on it. So why isn't it talked about more? Well, here's the thing, that a lot of practitioners, whether it's naturopathic doctors, functional medicine doctors, integrative health practitioners, health coaches, they don't really know where to place it. Because it's not a hormone, so you're not giving someone testosterone or estrogen or progesterone or some type of corticosteroid. And it's not a nutritional supplement, meaning like it's not a vitamin or a mineral. So what do we do with this thing called DHEA? So we're going to explain that today. I'm actually going to share with you who I use it for in my private practice, what we do over at Equilife, how I've used it myself in the past, and who should be using it, especially as you age. So I'm going to give you exactly what I do. Of course, I'm not going to provide you with any medical advice here today. No treatment protocols for any disease, no cures or diagnosis. We can't do that on a podcast. That's not what we do. But we're going to teach you everything that you need to know, at least for a starting point for DHEA. And then really just share with you, hey, what can I do? Should I use this for libido? Should I use it for stamina? Should I use it for mood? How about for metabolism, for energy, for all these different things? So we're going to go through that. Now, why can one hormone precursor do all of this? Well, what DHEA does, basically, you have cholesterol, which can then be essentially synthesized to pregnenolone, which can then either shift over to progesterone and cortisol, and aldosterone, so kind of more towards the stress pathway of the hormones, or pregnenolone can shift to DHEA, right? Dihydroepiandrosterone, and then it can then become either testosterone, or it can become estrogen, right? And it can become both, of course. So DHEA is almost like a stopping ground. Believe it or not, it can actually shift back up to progesterone too. So DHEA has a lot of promise, believe it or not, even in terms of immunity, especially, and I'll get into it right now, how I used it when I was suffering from Addison's disease, chronic fatigue syndrome, immunodeficiency syndrome many, many years ago. So when I met my first natural health-based doctor, they ran a lab, which, believe it or not, we still run to this day. I love how life comes full circle. That is our hormone testing. You can find that at stephencabral.com/hormone-testing. I want to make sure that that's the right link. I'll link it up today, though, either way, at stephencabral.com/2056 will be all of today's show notes. Let's see if that is hormone testing, though, because I want you to make sure that you can access this lab just like I did many years ago. How about hormone test? Could that be it? It is not it. So we're not going to spend the time looking for different lab tests. So I'm going to link it up today at stephencabral.com/2056 for today's show notes. And that will be that. So always a little strange when I can't find it just off the tip of my tongue, but these things do happen, right? We are a live podcast. So I will link that up for you today, but really important because what I want to make sure to do is basically open source these labs. So when I was a young 19-year-old, I'd already been suffering from autoimmune issues and Addison's disease for a couple years. I was fortunate enough to be introduced back in the late 90s to a functional medicine doctor back then. And they began with this saliva and just a little bit of like a finger stick blood drop lab. And I found out my cortisol levels, and I found out that they were very low, but along with that was also low DHEA. And so even though the protocol I was put on back then, I mean, this is going back some time now, was not the best. But again, keep in mind that this is over 20 years ago. So when you're looking at how far we've come, well, it's night and day. I mean, we have so much more knowledge. The internet wasn't even really around back then, right? I wasn't on the internet. And so now we have so much more knowledge. And DHEA, how it was used for me, was actually a huge pick-me-up, because it allowed my body to be able to shift what little hormone it had to be able to use it to produce a little bit more energy, a little bit more testosterone. So it was a game changer. But we have to keep in mind that a lot of people get frightened about using DHEA because they think that it's going to produce more testosterone, way more estrogen. And now, I'm going to share with you who shouldn't use it, but keep in mind that DHEA, it's only about 1/20th. So 1/20th as strong as testosterone. So as an androgen, it's only 1/20th as strong, but it can help both men and women. So this is for women. We use it for women in our practice all the time. This is not a male hormone. This is a precursor to testosterone and estrogen and itself DHEA, which helps with immunity. It helps with strength of body as well, but it can help with bone loss. So really important, even more important for women. It can help with muscle loss. Remember, 0.5 pound per year. Really important after about the age of 27. It can help with metabolism, no doubt about it, in terms of body fat burning. Improves immunity that I've spoken about. Helps boost mood, giving your body and brain energy. It improves your libido, especially as it's improving your testosterone levels. And it increases stamina as well. Basically, your tolerance to exercise, physical activity. So those are just some quick benefits on it. I've done a little bit of talk on DHEA before, but what I'd love to do is just give you some of the research right now. And then I'm going to share with you again exactly who should be using this. So what I'd like you to do is understand that our DHEA levels fall. It's exponential after around the age of, let's say, early 30s. And they start to decline until about age 70, when we're only at about 20 to 25% of our DHEA that we once had during our teenage and early 20 years. So that means that, yeah, you're not going to be feeling your best if you're depleted by 75% of your hormones, right, of your DHEA. So that's really important to look at that. And now, some of the sciences in terms of improving your libido. So it was found that in just a dosage, so a low dosage of 10 milligrams a day, which is exactly what we do, but I'll share with you how we break that up. And it was done for 12 months, and it helped to significantly improve sexual function and frequency compared to the control. So this is a study. This was done mainly on women, and this is in postmenopausal women as well, from 50 to 60. So it improved libido in younger females, and another study in women ages 50 to 60. So in terms of mood, studies have shown that it's improved overall well-being, anxiety, depression, and interest in sexual thoughts. So DHEA has been shown to improve overall alertness, stamina, sexual interest, and may also help with overall hormone therapy. In terms of boosting energy, so we have to understand that DHEA is converted to testosterone in the adrenals, and it's the primary source of testosterone for a lot of women. So when we look at adrenal sufficiency, that's why we need to run these labs, and we see there's a deficiency in cortisol. Well, we start to see a deficiency then in overall libido and overall testosterone levels and overall, not just sexual health, but overall feelings of vitality and ambition and drive in both men and women. Really important, especially even more so for women, where the DHEA is the primarily created in the adrenals. So fertility-wise, this is huge, and I want to read this exactly verbatim to you, because for a lot of women right now dealing with infertility, this could be a game changer. Again, I'm not giving medical advice, but I think that we should really heed this study. So in a randomized placebo-controlled study of women who had previously had a poor response to ovarian stimulation, DHEA was provided at 75 milligrams a day for a period of 6 weeks prior to ovulation induction and IVF procedures. Those receiving DHEA were observed to have significantly improved embryo quality as well as significantly higher live birth rate versus controls. Check out the statistics, 23.1% versus 4%. Much better statistics. And after 75 milligrams of micronized DHEA daily for a period of time, a substantial amount of women spontaneously became pregnant. So this is a separate study. So without any other IVF or anything else, 75 milligrams a day of DHEA, a substantial amount of the women became spontaneously pregnant. In fact, of the women taking DHEA, in the 39 women under age 40 who had previously been poor responders to IVF, there were 10 spontaneous pregnancies. That's about 25%. While in women age 40 and older, 21% of those taking DHEA became pregnant. Again, 21% versus about 26% for women under 40. So this is pretty impressive statistics. And then let's see. All right. The last one I have here for you is on anti-aging and longevity. So this is a 1-year randomized double-blind placebo trial. It was with 280 men and women. They were ages 60 to 79, and they were given 50 milligrams a day of DHEA or a placebo. And with supplementation, the DHEA levels were restored to normal, youthful levels in both sexes. That's men and women. In women, DHEA supplementation also led to a significant increase in both testosterone and estradiol levels. And we mentioned why that is. The study doesn't say why it is, but we know that's because that unlike men, where they can produce testosterone their whole life from testes, the adrenals are going to produce a lot of that DHEA and testosterone for women. So here's what we're looking at right now. We have all sorts of different studies from 10 milligrams to about 75 milligrams. How do you know if it's right for you and what to use? So what I always like to share with people is that there's bioindividuality for every individual. That means that you don't always know the right dose for you. So my recommendation, if you're going to lab test, the lab test, the link is actually stephencabral.com/hormones-test. And that will take you to a very simple at-home lab test that will test your cortisol, estrogen, testosterone, DHEA, thyroid, vitamin D, blood sugar levels, because you don't want to go to your doctor and test DHEA in isolation. It's one of the worst things that you can do. Doctors will do it for you, but it doesn't give you the overall picture. And then it doesn't obviously come with a plan. So that's why I do recommend the lab testing, stephencabral.com/hormones-test. But let's say you're not going to run the lab and you just want to try DHEA. Not my recommendation, because if you have high levels or moderate levels of DHEA or high or moderate levels of testosterone or high levels of estrogen in women, you don't want to be using DHEA, okay? There's no need for it, and also it could be detrimental because you don't want to raise testosterone levels in women that have PCOS or high androgen-based symptoms. And again, I have many podcasts on PCS if you want to tune in. And if you're a male and you're converting a lot of testosterone to estrogen because of stress, toxicity, viruses, heavy metals, then what you're doing is you're boosting testosterone levels, yes, but not usable testosterone, because then you're converting it to either dihydrotestosterone, which could cause hair loss on the head, body hair growth, like on the back, prostate swelling, etc. So you really want to make sure that you're not converting your testosterone to estrogen. Now, if you're not, well, then good. Then DHEA could possibly be very beneficial. So here's what we do. We use 10 milligrams a day, 5 milligrams essentially upon waking, and 5 milligrams with lunch or after lunch. Because when you look at DHEA movement throughout the day, the DHEA is at its highest in the morning, like testosterone, and then it begins to subsequently decline during the day, but not dramatically. It would not be detrimental to take DHEA like in the morning and at night. It wouldn't be the case because it's not a dramatic decline. DHEA is fairly steady. I've looked at many research studies on DHEA because because that's what I do. And unlike testosterone and other things where there's a big peak, you actually, and this is how I used it as well. The doctor I went to when I was 19 was very, very smart, very great at chemistry, I should say, in terms of endocrinology from a functional medicine perspective. And he was actually the first person to introduce me to functional chemistry in terms of hormones. And I will never forget that. I actually use the chart that he showed me to this day. So always appreciate, this was Dr. Gordon. I always give credit to my mentor, Dr. Pete, but I've had many mentors along the way, and Dr. Gordon was certainly one of them. So 5 milligrams twice a day, it's a small amount, but honestly, it's all that most people need. So we never use more nutritional supplements than a person needs. So that's what we do. And then what we do after using that upon waking and basically at lunch or right after lunch, we lab test 12 weeks later. So we say, okay, what did this do to DHEA levels? What did it do to estrogen, testosterone, and cortisol? Because now we can actually test and we don't have to guess, right? We can actually see what is this doing. Keep taking your DHEA, obviously, while you're doing the test so you can see how it affects you during the day. Now, there's a lot of research, and I shared it with you, on 50, 75, 100 milligrams a day. To me, that's way too much DHEA, meaning like, could you have gotten the same result with using 25 milligrams, with using 20 milligrams, which is what we'll do. So the most we ever use is we bump up to 10 and 10. So instead of 5 and 5, we'll bump up to 10 and 10, especially if a person's a little bit older. That's what we'll go to. I'll tell you right now that if you are 65 plus and you see yourself losing muscle mass, losing strength, losing a lot of the drive, all of the stamina that you had, I have no issues. Again, lab test first, but I have no issues with someone using 10 milligrams of DHEA twice a day. I can't tell you that you should do that. I can't give you medical advice, but I can see myself at age 65 using DHEA. Again, I can't exactly go by that. Maybe I use it at 62. Maybe I don't use it till 68. I'll lab test to see when my levels drop below 6 on the DHEA, and that's when I'll start to supplement with it. And same with testosterone. I won't supplement with testosterone. I'll supplement with DHEA. Too many men right now are supplementing with HRT and TRT at too young of an age. You're not going to get back your natural testosterone. You're going to have to be on it the rest of your life, and it can lead to cardiovascular issues. So we want to be a little careful with that. DHEA is a different story, and so I would supplement with DHEA personally if I needed to. Back in the day, taking this full circle, when I was 19 years old, I used it for about 4 months, and then I came off. And we do the same thing in our practice. We use it for 12 to 16 weeks, and then you stop taking your lunchtime dosage. You just use your morning dosage for another month. You're still feeling great. Your levels were good in the lab. Then we get off the morning dosage, and that's it. And then when would you start taking it again? Well, I was 19. I'm going to start taking it maybe in my 60s. You might decide to take it in your 50s based on your levels. So we can't tell you specifically, but what I can tell you to do is that you'll always be able to figure it out for yourself by running that hormone test. That's at stevencabral.com/hormones test. And if you just want to look at the DHEA, you can also go to stevencabral.com/DHEA. That's the exact product we use in our practice. Please keep in mind, you never need to run a lab test through my practice. You never need to purchase a nutritional supplement through my practice. That's not what this is all about. This is about bringing you the information that exists out there in order for you to rebalance your body. So I just want to be a vessel for this information. You can work with any naturopathic doctor that obviously is skilled in this particular area. You can work with any integrative health practitioner, a level 2, that can run these specific labs with you. It doesn't matter to me. I just want to make sure that you get the results that you're looking for and that you don't need to rely on pharmaceutical drugs in order for you to try to feel healthy and well, because again, we know that that's masking the symptoms. So let's get to the root cause. Remember, let's test when we can, not guess, and just know that there are products out there. There's the lifestyle and the products out there to help you feel your best. So hopefully this was helpful. Of course, if it was, please do feel free to share it with anyone else you believe it could serve. Take care, everyone. Thanks so much for tuning into today's show. It was a real pleasure being able to spend these past 20 minutes or so with you. And before you go, I want to make sure that you're always up to date on what we have going on over at Equilife, which is our integrative health, functional medicine-based virtual company, helping people all over the world in order to be able to rebalance their body, get to the root cause of what's suffering from, and then go on to live the life that they love. So what I want to do is just share with you really simply, we're giving away one of the most popular products we have in order to boost the immune system, keep your immune system healthy all fall and winter long. And that is a functional medicine zinc. That means it's functional medicine formulated. So it's formulated to actually work. It's formulated to have the exact dosage that it says in the bottle, and it's been third-party tested. So we are giving you a 25 milligram zinc picolinate product called FM Zinc, completely free on us. It is 60 capsules, so it will last you 2 months. This is a $30 value, completely free on all qualifying orders over $129. And yes, this ships worldwide. Head on over to StephenCabral.com/zinc for this particular offer. Again, that's StephenCabral.com/zinc and get your free bottle while supplies last.